Good evening. Thanks for joining us. The state of Idaho has not been spared when it comes to the opioid epidemic wreaking havoc across the country. The number of overdoses on the rise, the number of arrests on the rise. For the last year and a half, 6 on Your Side has been bringing you stories from those front lines, from paramedics, police, doctors, and addiction experts. We first told you today on Good Morning Idaho, Governor Brad Little is picking up the torch, announcing a panel that will work to find how to best fight substance abuse on all levels. Jessica Taylor explains how the state is looking to find hope in the battle against opioid addiction.
There's no easy one-step fix for combating the opioid addiction and epidemic, but Governor Brad Little signed an executive order to bring more agencies across the state together, even creating an opioid and substance use disorder advisory group. Idaho ranks 25th in the country from painkiller misuse and even higher for the amount of opioid prescriptions dispensed.
There we go.
Governor Brad Little is making strides towards combating the opioid epidemic across the state.
You know, the growing misuse of opioids has had a catastrophic effect, not only on Idaho, but our nation.
The executive order aims to work with multiple agencies like the Department of Health and Welfare, Board of Pharmacy, and Department of Correction.
There are so many different facets of this issue that we got to get our arms around.
The governor's office is also working with the Department of Education to weave opioid and substance early education with mental health education.
There's a lot of schools who don't have counselors. And you know, in a small school, it's a little different because all the teachers know all the students. In the larger schools and the medium-sized schools, it's a bigger problem.
Another goal of Little's executive order is limiting access to the prescriptions.
Opioid prescriptions are the cheapest way to treat pain. You just write a prescription. You don't have to have anybody around. They go to the pharmacy and get the prescription. We need to have better alternatives.
The order also touches on therapy, treatment, and referring first-time nonviolent drug offenders to local crisis centers instead of arrests. Little says it's estimated to take 18 months to see all the different facets of this executive order play out, but it will take much longer to combat the entire issue. Jessica Taylor, 6 on Your Side.
Governor Little sat down with our Roland Bears for an exclusive interview yesterday to give us a sneak peek at his opioid announcement. We had that story this morning on Good Morning Idaho and on 6onyourside.com. The governor says he spent time learning from other states as he formulated his plan for Idaho, but he says in talking to other governors, he learned they're looking at Idaho.
The Narcan naloxone bill that we passed this year is one of the best. It's the language in that bill or what other states are looking at.
Narcan is the drug that stops opioid overdoses immediately and saves thousands of lives every year. Idaho's law made it easier to access that medication. To see the full interview with the governor and to hear more about his visit to other states while formulating his own plan, go to this story at our website at 6onyourside.com.